Evaluation of circulation forms a critical part of your initial assessment. If, for some reason, blood is not adequately circulated, some of the cells and organs in the body will not receive an adequate supply of oxygen, and dangerous waste products will begin to build up. If the problem is not corrected, shock or hyperperfusion will occur. Severe bleeding, or hemorrhage, is one of the most common causes of shock. Signs of shock include pale, cool, or clammy skin, nausea and vomiting, vital sign changes, increased pulse, tachycardia, during compensation, followed by a quick, thready pulse, increased respirations during compensation, followed by labored, shallow, or irregular respirations, decreased blood pressure. Other signs of shock include thirst, dilated pupils, and cyanosis around the lips and nail beds. Bleeding may be external or internal. The three types of external bleeding include arterial bleeding, venous bleeding, and capillary bleeding. You can recognize each type of bleeding by the following signs. Arterial bleeding is a spurting blood with a pulsating flow that is bright red in color. Venous bleeding is a steady, slow flow and is a dark red color. Capillary bleeding is a slow, even flow. The major methods for controlling external bleeding are direct pressure, elevation, and pressure points. To control bleeding, you will need the following equipment: gloves, goggles, mask and/or gown, absorbent material such as gauze pads for dressing, bandaging material such as cling, roller gauze or elastic bandages, pressure dressing. Take BSI precautions. This is important because there may be direct contact with possible blood-borne pathogens. Use gloves at a minimum, a gown for gross hemorrhage, and goggles and a mask or a face shield for spurting blood. Estimate the amount of blood lost by the patient. The adult body has approximately 6 liters of blood. Hemorrhage greater than 1 liter can be life-threatening and cause shock. However, you should not rely on the very late sign of hypoperfusion to determine if your patient is in shock. Uncontrolled bleeding can be life-threatening and should be managed immediately. Now let's look at how bleeding is controlled. Take BSI precautions. Expose the wound if possible. Apply direct pressure to the wound. Elevate the injury to above the level of the heart. If bleeding persists, apply additional dressing material and continue direct pressure. Locate the arterial pulse proximal to the injury site and apply firm pressure. Bandage the dressing in place with roller gauze, elastic bandages, triangular bandages, or cravats. Assess distal circulation to ensure that the bandage was not applied too tightly. Position the patient properly and begin transport. Treat for shock if needed. Appropriate treatment for shock includes properly positioning the patient, maintaining the airway and administering high-flow oxygen, reassuring the patient to reduce anxiety, elevating the supine patient's legs above chest level, preventing heat loss from the patient's body, monitoring the patient. Now let's take a look at the steps and some problems you might encounter. Be sure to manage all life threats before bandaging a wound. Take BSI precautions. Expose the wound if possible. Apply direct pressure to the wound. Do this with a gloved hand and a gauzed pad or other dressing material. Elevate the injury to above the level of the heart. This makes it harder for the heart to pump blood to the injured area. If bleeding persists, apply additional dressing material and continue direct pressure. Locate the arterial pulse proximal to the injury site and apply firm pressure. Bleeding to the leg can be controlled by the femoral pulse. Bleeding to the upper extremities can be controlled with pressure on the brachial artery. Bandage the dressing in place with roller gauze, elastic bandages, triangular bandages, or cravats. Assess distal circulation to ensure that the bandage was not applied too tightly. The intent is to control the bleeding, not apply a tourniquet to the area. To ensure uniform contact and pressure over the wound, wrap a pressure dressing from distal to proximal. Position the patient properly and begin transport. Treat for shock if needed. Appropriate treatment for shock includes properly positioning the patient, usually supine rather than sitting, so that the patient will not fall and injure himself. Maintaining the airway and administering high-flow oxygen. Reassuring the patient to reduce anxiety. Elevating the patient's legs above chest level or in the Trendelenburg position. Preventing heat loss from the patient's body. This is commonly done by applying a blanket over the patient. Monitoring the patient for changes in mental status and vital signs. Reassess stable patients every 15 minutes and unstable patients every 5 minutes. Retake vital signs and reevaluate the physical exam. Be sure to manage all life threats before spending time bandaging wounds. It is inappropriate to carefully bandage a small wound if the patient is not breathing or has other, more serious injuries. If bleeding soaks through your bandage, apply additional dressings and a pressure bandage. Do not remove the soaked material. Doing so may break away clots that have begun to form, a necessary process in healing the patient's wound. Bleeding from a neck or chest wound should be controlled with an occlusive dressing that prevents any air from entering the wound's site. Occlusive materials include any non-breathable substance, such as a gloved hand, Vaseline, gauze, or plastic wrap. Active bleeding will cleanse many wounds. Although thorough cleaning is not the responsibility of the first responder, avoid further contamination. In the absence of appropriate dressing and bandaging material, any clean cloth can work. Look for materials such as sheets, towels, and even clothing. Some EMS systems may allow the first responder to use air splints and the pneumatic anti-shock garment, or PASG, for hemorrhage control, since these devices use circumferential pressure to control bleeding. In cases of profuse bleeding, do not waste time finding a dressing. Instead, use your gloved hand to apply direct pressure. You may be unable to apply an effective pressure dressing to some parts of the body. Tourniquets should only be used as a last effort in uncontrolled external hemorrhage. The inappropriately or incorrectly applied tourniquet can do more damage than good.